So a lady came in for her adjustment the other day. She's 87 years old. She came to see me about 5 years ago. She had a ton of neck pain, could barely turn her head. She's had a huge improvement in the function of her spine, but also in her symptoms. And so when she came, we knew her bone density wasn't great. She had been diagnosed with osteoporosis. And so she comes in, and she had about a week or two ago, and she had a bone. So a lady came in for her adjustment the other day, and she is 87 years old. And she's had a bone mineral density test that was done several years before, and it showed that there was some decrease in density, and she was diagnosed with osteoporosis. Now, she's been under care for 5 years and getting regular care over this whole time. And when she first came in, she had a ton of neck pain, could barely move, and she's had a huge improvement in that, in how she feels and the symptoms, but also the movement of her spine. But she recently had another bone mineral density test done that her doctor ordered. And the previous one was from 11 years before, and the one was just now. So there's nothing else in between those two comparisons. But she gives me the report, and I was kind of confused. It says in her lumbar spine, so that's one of the areas they check for bone density. There's an increase of 12.3% in her bone density. At 87 years old, how many people would you expect to see an increase in bone density with? Like, you'd probably say zero, because it's pretty unlikely. And she hasn't been taking drugs or injections, or no significant lifestyle changes from that previous test till the current one. And she said, well, maybe getting adjusted has increased the density of the bones in my spine. And I've been doing this 20 years, and I was like, I don't know, maybe, like, I've seen some pretty amazing things, but I don't know if adjusting changes bone density. And it was bugging me, and I was like, I got to look this up and see if there's any research or any evidence showing that chiropractic adjustments actually increase bone density. And guess what I found? So in 2020, there was a study done. They did it on rabbits. So they actually intentionally, it's not great, but they intentionally damaged the joints of the rabbits to try to understand how osteoarthritis or joint degeneration arthritis affects the joint itself, but also the bone. So they did that. And then what they did is, on one side of their body, they adjusted them, the chiropractic adjustment. And on the other side, they didn't do anything. So they actually did a sham or a fake adjustment on that side. So it was not the same, obviously, as the chiropractic adjustment side. So they look at, then in the microscope, they look at a micro CT, so the very fine detail about what exactly is happening with the bone. And what do they find? They find an increase in bone density on the side that got adjusted, and an increase in the health of the cartilage as well. And so what they are saying is that the chiropractic adjustment on that side was actually protective, or helped the cartilage from degenerating any more than it already had. So it was protective, is the word they use, of joint degeneration. At the same time, it increased the bone density around that joint. And so I started doing the math, going, yeah, you know what? It definitely is possible for the bone density to increase in an area that's getting adjusted. And so just like any other chiropractic adjustment, the purpose is not to treat a symptom. Someone who has back pain, someone who has neck pain or headaches or tingling in their arm, or sciatica, or poor digestion or poor breathing, or poor immune function, a chiropractic adjustment isn't treating any of those symptoms, just like it's not treating bone density. And now I understand this better, but I know we're not treating someone who's got poor bone density. But when you have less pressure on nerves, when your body's able to express life and health better, the result is better function, better healing, and based on this research shows, things like better bone mineral density. So it's fascinating to me. Maybe you find that interesting, but there's really no limit in when you improve the expression of the nerve system, when you improve nerve connection, there's no limit to what your body can't do, because of that better connection from your brain through your spinal cord out to every muscle, tissue, and cell. Hope you're having an awesome day, and we'll talk to you soon.